Dr. Angela Canfield, and since it's Oral Health Cancer Month with the month of April, I'm going to discuss a little bit about oral cancer. 1 in every 60 minutes die of oral cancer. It's more actually than cervical cancer because of all the testing that we have for cervical cancer now, and everybody goes for their yearly checkups. So now oral cancer is the leading cause of death. 40% diagnosed will die within 5 years. And the reason for that is because it spreads so quickly and it's caught so late. Early detection increases your risk or increases your survival rate to 80 to 90%. So that's why as a dentist, we're so wanting you to make sure you get in for your every 6-month visits, to make sure that you get in and get screenings. And there's all different types of screenings that I'm going to talk about that you can do. The fastest growing segment of oral cancer in the population is actually young non-smokers that are actually HPV carriers, so people that are 16 and plus, which you usually think smokers, alcohol is, and those are high risk factors, but actually the most growing population are young non-smokers. So anybody we recommend that's 18 or over to be able to get tested for oral cancer. And like I said, tobacco and alcohol still are major risk factors, but everybody 18 and plus, we recommended to get at least tested once a year for oral cancer. There's a couple of pathways to get oral cancer, and one is tobacco and alcohol increases your risks with your inflammation in your body to be able to get cancer. The other, and the most common, is a human papillomavirus, the HPV virus. And then it is a sexually transmitted virus in the United States. And both pathways present a little bit differently. So when we test for oral cancer, there's some different tests that we do to take. One is a visual test. A lot of times if we see something visual, it's in the later stages. So our new test, and kind of what everybody's excited about in the dental field, is it's called our MOP test. And basically it tests on the cellular level your DNA to see if there's any changes that's starting. So if we can get to see where those changes are starting with the cells and the DNA, then we can know that you're a risk factor, and either if we need to get you to an ENT, or if it's just something that could turn into something precancerous, we test you every 6 months. So it's a simple test. You come in, you swish, you spit, it goes off to a lab. It's grown in a petri dish, and you get your results back in about 2 to 3 weeks. So we recommend everybody get that once a year. If your results do come back a little bit concerning, then we recommend 6 months. We retest it again, and we keep doing that just so we can get it quickly, because we want to be in that survival rate of 80 to 90%. So is there any questions?
Well, what are some of the symptoms?
Like I said, if you see symptoms, usually we've kind of got past the point of where things are good. But any kind of like lesion that you would have on your tongue, white area, red area, any pain, bumps or lumps that's in your mouth, even loose teeth with a lesion growing around it can be an issue of concern, jaw pain. And a lot of times the HPV virus actually is back of your mouth or in your neck and throat area is where it kind of presents. The other ones are more common on your tongue and towards the front of your mouth with alcohol, tobacco related.
So if you are diagnosed with oral cancer, what happens next?
Usually you're sent for a formal biopsy to an ENT's office or a neurosurgeon's office, and then it's usually tried to be removed if we can get all the borders removed. Sometimes cancer radiation is recommended.
You talked about how the test can determine if you have oral cancer on a cellular level, and it actually looks at your DNA.
Mm-hmm.
Is that the earliest part, that's the first thing that changes?
Yes, it is. Yeah, that's the first way that you'll be able to tell. The other risk factors are, of course, your age, smoking, drinking, and of course, genetics too. If you have anybody else in your family that's had it, then I would recommend you to get tested first. But as far as what medically that we can see, changes in your oral DNA, yeah, on a cellular level.
And how do they determine if it changes?
They look at your DNA and the way it's linked, and if there's any kind of variation to what it should be, then that they're suspicious for, and they look for the HPV virus is usually what they're looking for. It's a great test that's come out. It's hopefully will save a lot of people's lives. And it's kind of like what we were talking about, that, women go every year and they get their pap smear. That's kind of what we hope will happen, that everybody, male and female, will come every year and get tested. That's what eventually we would hope would happen. So.
Is there a reported number of cases of higher in males or females?
Males are usually a little bit higher, yes, and I'm not really quite sure the reason for that, but statistically males tend to be a little bit higher than females. Yeah.
Typically, you mentioned finding it out quicker was better.
Mm-hmm.
What's the time frame that you would like one of your patients to discover? It would be ideally better than like a 6 months after. When is it like the last?
Right. So once you see anything, that if you see a lesion in your mouth or have a lesion in your mouth, then we're already concerned that it can be spread to your lymph nodes or anything like that. So really the pre-testing, like you do, like a mammogram or a pap smear or like colonoscopy or anything like that, that's what we would recommend to do to get it really early. But as soon as you see a lesion, anything that you're suspicious, even if it ends up being nothing, it's better to get checked immediately than waiting 6 months. I mean, 6 months you could lose half your face, half your jaw, half your tongue. I mean, so it spreads very quickly, so it does.
Dr. Canfield, is there any way to prevent oral cancer?
I mean, smoking, alcohol, no. As far as that goes, lifestyle, proper diet, obviously taking care of yourself as you do before. But I mean, be careful, like, as far as your partners and different things like that and what your extracurricular activities, yes. But otherwise, some of it's genetic. I mean, so.
That's really incredible that there's that connection.
Mm-hmm.
How long have they known about that HPV connection with oral cancer?
It's not, I mean, we've known about it for a while, but studies have really, in the past, 8 years, have really gained a lot, and that's why this test has come out. And things have really started. We knew that it could cause oral cancer, but not to the extent that it does. Till here more recently.
You mentioned that 1 in every
60 minutes.
60 minutes, someone dies from oral cancer. Do you have any idea of how many people that affect in the United States, or is that worldwide?
Yeah, about 43,250 Americans will be diagnosed with oral cancer this year alone. So the worldwide, the problem is much greater. There's new cases exceeding 640,000 yearly. So there's a lot of people that's infected by it as far as that goes. So, if you have any kind of symptoms like swallowing, pain, red lesions, white lesions, pain in your mouth, even like for throat areas, like a constant cough or a tickle that just won't go away, that's not seasonal related or something like that, or an earache, all those should be checked by your dentist or an ENT, or at least go to your general doctor and then get referred out. But all those things are very important to get checked immediately.
How much does a normal test cost for this?
So the mop tests that we offer, they're $10 to administer the test, and then it's sent off to a lab, and it's covered by your medical insurance. Right now, they're wanting to do so many research on this. So right now, unless things have changed over time, whatever your medical insurance pays for is really all that they're asking for. So as long as your deductible's met and all that, then you should be pretty good. But they're really willing to work with us because they're wanting everybody to do this, because they're wanting to use it for research. So it's a good thing. So it is. It makes our cost very minimal.
Dr. Canfield, I do have a question about fever blisters are considered HPV-1, I think. I don't know how many strands there are of HPV of the virus, but how does that correlate as far as someone having a fever blister that may cause oral cancer versus a different kind of HPV?
Right, that's a good question. I don't want to scare everybody, but there's about 200 strains of HPV. Okay. So not every strand of HPV or cold sore means that you're going to have oral cancer. So don't be alarmed by that. But if it is a cold sore or a lesion that lasts more than 10 days, I would recommend you to get it checked. Okay. So I would. But HPV-16 is really the one that we see most common that causes, especially the back of the throat and the back of the mouth cancer. It's the same one that causes cervical cancer as well.
Okay, yeah. Thank you very much.
again, Phyllis, when you do discover that you have oral cancer and that your test results are positive, what treatment options do you have?
Okay, so if you get a genetic test, the DNA test back, and it says it's precancerous, we usually just check it in 6 months. If it comes back and there is cancer detection cells actually that are cancerous, then I would send you to an ENT. But once you get to an ENT, then they're going to go over some options. And that's one thing the test is so important for, is because we're trying to do studies to figure out what's the best way to do before a lesion occurs, what's the best way to treat it. But sometimes head and neck radiation, because we're at a cellular level, to get that is a common thing. If you already have a lesion and we get the lesion biopsied and it comes back that it's cancerous, then of course going back in, complete removal of that area, making sure we get clear borders where there's no cancer cells there. And then if there's any indication from like a PET scan that it's moved into your lymph nodes or anything like that, then you would need chemo or radiation depending on the situation.
If a patient asks you just to pull the tooth that was bothering them with the laceration, does that affect it in any way?
No, it would not. If you pull the tooth, it's not going to cure anything or it's not going to help with the cancer or anything like that. So it's not, you may lose teeth because of the cancer, especially if there's a lesion attached to the teeth or anything like that. But you can have the tooth taken out, but you're still going to need treatment.
And how long do you have in between finding out that you have cancer and then to the point where you talked about losing half your face and stuff like that? What's your time frame you're looking at?
It depends on how fast it grows. It depends on the person. There's a lot of factors, but within 6 months, I had a patient that had a lesion on her tongue, and she didn't go get it followed up with the oral cancer, with the oral surgeon, for about 6 months. And then when I saw her, it was much worse, and she lost, a good quarter of her tongue and some areas down below it.
So how genetic is oral cancer?
That's what they're studying right now. There's no statistics out as far as that goes. But, we're finding there's a lot of things like periodontal disease, different things in dentistry that are genetic. And so that's I have not seen a statistic or a number talking about, what most of the things that they're saying really is there's 2 pathways. It's alcohol and cigarettes or the HPV virus. But then they're saying genetic-wise, how susceptible you are to the HPV virus could be genetically related.
Are there any myths surrounding oral cancer that you've seen?
Yeah, especially recently, there's this oil pulling thing that's out there that there's different things with that won't. That's not going to cure cancer. If it did, that would be a great thing, but it's not. There's like essential oils that people are trying to use and all this. Different things like that, but really, as far as going to a medical doctor, I understand people don't want to take medicine, they don't want to do chemo, they don't want to do those kind of drugs and put them into your body, but when it comes to cancer and this kind of point, then, you just don't want to mess around with it. But as far as wise tales, those are the most recent things. The oil pulling, I think, is the most common question I get for, I think it cures everything.
And when you say tobacco, meaning cigarettes, are you also talking about tobacco like that people put in their lips and
Yes.
stuff like that, that's directly up against their
Cheek,
gum
yes.
or their cheek?
So any type of tobacco use, yes. A lot of times I can even tell a patient uses tobacco when they come in because I'll see a white patch and I'll be like, so do you hold your snuff here? And they look at me like, yeah.
Wow.
So anything like that,
Okay.
yeah.
Do you notice, or have there been any studies that have determined if there's any differences in the appearance of oral cancer in different races or ethnicities?
No, I think the skin in your mouth is pigmented differently. So it could form a little bit different, but for the most part, it's all the same. Yeah.
Tell us about how important the mouth is to your overall health of your body.
Yeah. So like I said too in the beginning, just overall health in general helps us keep healthy from cancers in general, as well as oral cancer. You know, there's so many things that's tied to your mouth with your overall health. Your heart, anything, heart issues that you have, if you have bacteria that's in your mouth and then it gets into your bloodstream, it can go directly to your heart. It can cause issues. Diabetes, a lot of times people that have diabetes, if they have mouth issues, then they tend not to be regulated as easily if they don't get that stuff taken care of. Pregnancy, low-term birth weight babies, fertility issues, all that can be related to dental health as well. So there's tons of them. I could go on and on. But
so to sum it up, what do you recommend people to do for oral health and mouth health?
Recommend everybody to get checked by a dentist every 6 months. Come in, get an exam, at least get x-rays once a year, and get a cleaning every 6 months.